Here to weigh in on the progress of psychedelic-assisted therapies is Michael Mullet, Chief Operating Officer of MAPS Public Benefit Corporation. The organization is focused on developing MMDA-assisted therapies for post-traumatic stress disorder, which could see FDA approval as early as next year. Great to have you with us. There's just a big conference in Colorado last week about this, so there's a lot of interest. How far is it from becoming, the next cannabis in your view?
Yeah, first of all, I appreciate you having me, Melissa. This is a really exciting time. Denver was a really exciting conference with over 12,000 people in attendance. I think the biggest takeaway from that is that over half of those people in attendance were medical providers. They were therapists and physicians looking to apply MDMA-assisted therapy and other psychedelics to their toolbox to help people with very significant mental health conditions like PTSD. So it's been a really exciting time.
Your background is from traditional pharma, Sanofi, as well as Moderna. Are you getting the sense that big pharma is going to join in on the action, or is it going to be like in the cannabis industry, really the territory of upstarts, of other companies out there that exist now?
Yeah, I think that maybe a few things. I think the approach for psychedelics and psychedelic-assisted therapies is a bit different than that of cannabis. A good thing that we like to point to, especially in this space, are launches from providers like Janssen for Spravato or GW Pharma with Epidiolex, GW Pharma, which is now Jazz, with Epidiolex, which are prescription medications delivered in the healthcare system. And psychedelic-assisted therapies like MDMA-assisted therapy, which is what we are working on, will all be provided in the healthcare system. So we see more parallels in the pharmaceutical space for rollout and sensitivities.
Michael, the venerable Wall Street Journal had an article today called "The Drugs That Power Silicon Valley." It's talking about LSD, ketamine, magic mushrooms. The first line of this article states Elon Musk tastes ketamine.
Yeah.
Is the stigma gone from these drugs? Like, it seems like these are like serious drugs. They were like
Schedule 1 drugs.
Schedule 1 drugs. So it's just kind of interesting. That struck me before I knew you were going to be on today. I read that article this morning and I was like kind of floored.
Yeah, look, I think the stigma is certainly going away. And of course, because there's so much data. One of the really exciting points that I always like to point out to people is that the FDA presented in March a slide that showed the number of clinical papers that have been delivered on the space of psychedelics over the last few years, and it's remarkable, this uptick. So as the science develops, as the science evolves, so too go with it all of the public perception. So where we stand in clinical trials today, we've completed 2 phase 3 studies and are ready to develop an approval process with the FDA. We will be submitting MDMA-assisted therapy for the use in PTSD in the fall, with approval as early as next year. So I think the data will lead.
So PTSD, what are some of the other use cases for this potentially?
Well, I think first of all, PTSD is a huge one. PTSD affects 13 million people in the United States today, veterans, women, disproportionately affects women. I think the next disorders, especially for MDMA, can be things that are focused in trauma. What MDMA helps people to do is actually address root cause trauma as opposed to masking symptoms. So I think it's really important to look at trauma-informed diseases or mental health conditions.